donation process are considered to be of a lower risk due to the fact that it's one-on-one donation, the donor and the recipient know each other, and there is a low level of exposure within the distribution chain. All sperm and ova donors must undergo the donor suitability assessment and, if applicable, donor reassessment to identify any risk factors for infectious and genetic disease transmission, which could impact the safety of sperm and ova. The donor suitability assessment must be conducted and documented by the medical director or a physician or a nurse practitioner designated by the medical director. A primary establishment is responsible for ensuring that donor suitability assessment is conducted in accordance with the safety regulations, including if it is carried out in part or in whole by another establishment on its behalf. Donor suitability assessment is based on donor screening, physical examination, and donor testing, and must be conducted in accordance with the requirements that are set out in Health Canada's directive titled Technical Requirements for Conducting Suitability Assessment of Sperm and Ova Donors. It is important to note that for the purpose of safety regulations, donor testing includes retesting of sperm donors 6 months following their donation. This is to ensure that sperm donors do not test positive for a disease that may not have been detected at the time of initial testing. However, retesting of ova donors is not required by the safety regulations. In the case of a repeat donor, that is, in the case where a sperm or ova donor donates more than once, donor reassessment must be conducted to monitor for any risk of infectious and genetic disease transmission since the initial donor suitability assessment was conducted. Sperm and ova donors subject to the regular process must undergo donor screening, physical examination, and donor testing in accordance with the regulations. And a medical director must determine if a donor is suitable to donate based on the donor exclusion criteria outlined in the directive. If a donor is determined to be suitable, a medical director must create and sign a summary document that is intended to accompany the donation throughout the distribution chain. The summary document provides the health professional with sufficient information to assess any risks associated with the donation. Subsequently, the donation can be released from quarantine, and the donation must be properly identified and labeled prior to it being distributed, imported, or made use of by an establishment or health professional. However, if the donor is determined to be unsuitable to donate, or in the case of sperm donors, if the retesting results are positive, a donation may still be released from quarantine under narrow exceptional circumstances. This is called exceptional access. So the exceptional access may only be permitted if one of the following two conditions are met. Number one, where the recipient has previously been exposed to sperm or ova from that donor, and the results of the donor suitability assessment indicate that the risk profile of the requested sperm or ova under the exceptional access is equivalent to the risk profile of the sperm or ova to which the recipient was previously exposed. Or number two, where sperm or ova from the donor will be used to create a genetic sibling for the individual or couple. In order for a donation to be released from quarantine under exceptional access, a medical director must create a summary document that includes any available donor screening and testing results and reasons the donor was determined to be unsuitable. Any sperm or ova that are intended for exceptional access must remain in segregated storage during its distribution or importation, and the immediate container must contain a statement that indicates that the donation is for exceptional access only. Also, prior to the use of sperm or ova under exceptional access, a health professional must create a document that states that the use of the sperm or ova would not pose a serious health risk to the recipient, and document that the informed consent of the recipient has been obtained. However, Health Canada will not prescribe a way that these requirements are met. and as such will leave it up to the health professional to decide how to meet these requirements. For example, whether to create a separate document to obtain written consent, or whether the consent form that the patient signs is designed in such a way that it is sufficient to meet these requirements. A primary establishment is responsible for ensuring that its medical director determines the suitability of sperm and ova donors by reviewing the results of donor suitability assessment and reassessment if applicable. The donor is considered unsuitable to donate if the donor meets one or more of the donor exclusion criteria as set out in the directive, or if the donor suitability assessment was not completed in accordance with the safety regulations. Once a donor has been determined to be suitable, the medical director at the primary establishment must create and sign a summary document that is intended to accompany the donation throughout the distribution chain. The purpose of the summary document is to provide the health professional who intends to make use of sperm or ova or distribute it to a recipient for their personal use with sufficient information to assess any risks associated with the donation. The summary document must contain important information about the donor, and that includes donor's age at the time of donation, a statement that the donor suitability assessment and, when applicable, the reassessment have been conducted in accordance with the safety regulations. It also includes the dates and results of all donor testing and the assessment of the risk of genetic disease transmission. A donor subject to the regular process requirements who meet one or more of the donor exclusion criteria set out in the directive is considered unsuitable to donate. For example, a donor who meets any of the infectious disease screening criteria outlined in the directive, or who is either symptomatic or has previously been diagnosed with a serious autosomal dominant or X-linked genetic disease must be considered unsuitable to donate. Similarly, the donor who tests positive for any of the infectious disease agents set out in the directive, except in the case of syphilis and CMV, must be determined unsuitable. In the case of CMV, a donor must be tested negative for CMV IgM, and in the case of syphilis, a donor must be tested negative using a treponema-specific test in order for the donor to be determined suitable. In addition, any donor sperm or ova obtained during a time period in which infections of chlamydia and gonorrhea cannot be ruled out must not be released from quarantine as well. In the case where donor and recipient know one another, the donor and sperm may be processed in accordance with the directed donation process requirements. As such, a health professional must request the sperm or ova from a primary establishment on behalf of the recipient. Under the directed donation process, a donor must undergo donor suitability assessment, including donor screening, physical examination, and donor testing in accordance with the requirements set out in the directive. A repeat directed donor is also required to undergo donor reassessment as per the requirements outlined in the directive. It is important to note that, unlike the regular process, directed sperm donors are not required to be retested 6 months following their donation. There is no need to quarantine directed sperm or ova donation if all of the requirements of donor suitability and summary document are met prior to the donation. As such, the use of fresh sperm or ova is permitted under the directed donation process. Also, unlike the regular process, a directed donor is not determined to be unsuitable even if their donor suitability assessment results otherwise would make them unsuitable under the regular process. Instead, the medical director is required to review the donor suitability assessment results and create and sign a summary document that includes screening and testing results and that must accompany the donation. Upon release from quarantine, the donation must be properly identified and labeled and must be kept in segregated storage during its distribution or importation. Now, there may be specific scenarios under the directed donation process where it may not be possible to conduct donor suitability assessment in accordance with the safety regulations. For example, If a donor cryopreserves their own sperm or ova for their own use, and at that time a complete donor suitability assessment wasn't conducted, because safety regulations do not apply to such scenario, and subsequently the donor decides to donate sperm or ova to someone they know. In such cases, donation can still be used under narrow circumstances, provided that the medical director reviews the available medical information and conduct retroactive donor suitability assessment if possible. The medical director must create and sign a summary document before the donation can be released from quarantine. In addition, the donation must also be properly identified and labeled and must be kept in segregated storage during its distribution or importation. Prior to the use, a health professional must create a document that states that the use of sperm or ova would not pose a serious risk to the recipient and document the informed consent of the recipient. As mentioned earlier, a directed sperm or ova donor is not excluded from donating based on the donor suitability assessment results. Instead, the medical director at the primary establishment must review the information gathered from the donor suitability assessment and, if applicable, donor reassessment and create a signed summary document. The summary document confirms the review of the information gathered through the donor suitability assessment and provides important information to the health professional who intends to make use of the sperm or ova. And the summary document, the information that must be included on the summary document includes donor's age at the time of donation, statement that the donor suitability assessment and, if applicable, reassessment have been conducted in accordance with these regulations. It must also include dates and results of donor testing and the risk assessment of genetic disease transmission, and a list of any donor exclusion criteria that have been met. Also, prior to making use of sperm or ova released under directed donation or distributing it to a recipient for their personal use, the health professional must document that, based on the information contained in the summary document and any risk mitigation measures taken, in their medical opinion, the use of donation would not pose a serious risk to human health and safety. The health professional must also document that they have informed the recipient of the risk that the use of sperm or ova donation could pose, such as instances where the effectiveness of risk mitigation measures may be very high but not absolute, and that they have obtained written consent from the recipient to make use of the sperm or ova.
Okay. The next portion of the presentation will walk through the quality management requirements under the safety regulations. It is important that establishments that conduct processing, importing, or distributing sperm or ova do so in such a way that reduces the risk to human health and safety and the safety of sperm or ova by having appropriate quality management measures in place. This includes taking measures to prevent the contamination or cross-contamination, to prevent the transmission of an infectious disease, and to maintain the quality of the sperm or ova. Establishments must have a quality management system with respect to the activities they conduct under the safety regulations. The quality management system itself is comprised of 4 main components which must be established by each establishment and include standard operating procedures, a process control program that includes a system for verifying and validating any changes to a procedure, a system that allows for process improvement that includes complaint monitoring and the implementation of corrective and preventive actions, including conducting recalls, and a document control and records management system. In addition, all establishments conducting an activity regulated under the safety regulations must establish an internal audit system and must perform an internal audit every 2 years on all regulated activities they conduct to verify those activities comply with the safety regulations and the establishment's standard operating procedures. The findings from audits and follow-up actions required must be documented and reviewed by management as well as the individual responsible for the quality management system. Preventative and corrective measures must be implemented in a timely manner. Establishments must retain records of these audits including the preventative and corrective actions in accordance with the record requirements under Section 77 of the safety regulations. The ability to effectively trace sperm and ova throughout the distribution chain is key to protecting the health and safety of Canadians. Establishments must establish and maintain a system for tracing sperm and ova. Since primary establishments are at the head of the distribution chain, they have the responsibility for ensuring that the foundational elements of an effective tracing scheme are established. The primary establishment must assign a unique donor identification code to each donor, which will allow for the donor to be identified no matter where an individual donation may be in the distribution chain. The primary establishment is also responsible for assigning a donation code to each specific donation. The donation code must indicate the date of donation and link the donation to the donor. This allows for more targeted tracing if a situation requires, for example, in the event of an adverse reaction. Another key component of an effective tracing scheme is labeling. Establishments that label an immediate container must establish and maintain a labeling control system. The regulatory requirements for labeling were designed to reflect that it may not always be the primary establishment who labels the immediate container of sperm or ova. For example, an ova bank that is a primary establishment may use a separate medical facility to retrieve the ova from the donor. In this case, that facility would be an establishment conducting activities on behalf of the primary establishment. It may be the case that after obtaining, preparing, and preserving the ova, the facility also labels the immediate container prior to shipping the container to the primary establishment for long-term storage. The immediate container is the innermost package that contains the sperm or ova, and the shipping container is the outermost package in which the sperm or ova is delivered or transported. An establishment that labels must ensure that the donor identification code and the donation code appear on the label in a clear and indelible manner. While the safety regulations are not prescriptive about the mechanism by which this occurs, where the establishment that labels is not the primary establishment, some communication between the two parties will be required to enable the establishment to fulfill its obligations, given that it is the responsibility of the primary establishment to assign the donor identification and donation codes. An establishment that distributes, imports, or makes use of sperm or ova must examine the immediate container and shipping container for damage and evidence of contamination or tampering or mislabeling. They must compare the donation information on the label to the associated paperwork, and when any defect, suspected inaccuracy, or illegible labeling or abnormal appearance is observed, the sperm or ova must be immediately quarantined until an investigation is completed under the error and accident requirements. Sperm and ova must be stored in the appropriate temperature range and according to the instructions in the documentation that accompany the sperm and ova. Establishments that store sperm or ova must establish and maintain standards for acceptable storage and must ensure that sperm or ova is stored within these appropriate environmental conditions. Documentation showing that the sperm or ova was maintained under the appropriate environmental conditions must be retained. Establishments that ship sperm and ova must establish and maintain shipping standards, including the appropriate environmental conditions, which must be defined in a standard operating procedure. An establishment that ships sperm or ova must ensure they use immediate containers and shipping containers that are appropriate for both maintaining environmental conditions and resisting damage during shipping. The packaging materials must also be compatible with the sperm and ova in order to prevent any interactions which may cause the package to degrade or chemicals from the packaging to be absorbed by the sperm and ova. Okay, establishments must have a sufficient number of personnel to perform the tasks required. All personnel performing or responsible for regulated activities must be qualified in accordance with the establishment's training policies and have the necessary combination of education and or experience. Lack of sufficient personnel or underqualified staff may increase the risk of errors and accidents. Establishments must have a documented training program as well as a formal competency evaluation program. Personnel must receive initial and ongoing training appropriate to their job responsibilities related to activities regulated under the safety regulations. Training must be documented and must include information necessary to verify that individuals have been trained prior to the conduct of the activities. The facilities where an establishment conducts its activities must be located, designed, constructed, and adapted to suit the activities to be conducted. Their design and furnishing must minimize the risks of errors and accidents and the potential for contamination or cross-contamination. Facilities must allow for effective decontamination to prevent cross-contamination during the movement of personnel and materials between different areas. Establishments' facilities must control access to all areas where its activities are conducted and where products and samples are stored. Establishments must ensure the products that are used for the cleaning, maintaining, and disinfection are appropriate to prevent the contamination and cross-contamination in all areas where activities are conducted. Establishments must have appropriate environmental controls and must monitor and document the readings to ensure environmental controls are maintained. Establishments must have environmental monitoring procedures, which should include acceptable limits for all environmental parameters. When values are found to be outside of the acceptable limits, then corrective actions must be taken and may require relocation of the sperm or ova or temporarily discontinuing those specified activities. All sperm and ova must be stored under defined and controlled environmental conditions. Environmental parameters for storage, such as temperature and humidity, must be controlled and monitored using calibrated monitoring devices. The documented evidence of the monitoring of these parameters must be maintained. There must be written procedures describing the actions to be taken in the event of deviations from established storage criteria. Such an event must be appropriately investigated and documented. Establishments must have a system to identify, document, and track all critical equipment and supplies. The term critical supplies applies to equipment. The term critical applies to equipment, supplies, and services used in any activities that are regulated under the safety regulations. Examples of critical equipment, supplies, and services include, but are not limited to, those that are used in the collection, testing, and storage of sperm and ova. Written specifications must be available for all critical equipment, supplies, and services. In cases where the specifications are not met, an establishment must have a system in place to ensure prompt, effective remedial action, which could include the timely reporting of complaints, deviations, or product defects to their supplier or service provider. All critical equipment must be cleaned and maintained in accordance with standard operating procedures and schedules based on the manufacturer's instructions with the purpose to prevent contamination or cross-contamination. Equipment must be qualified and calibrated according to the manufacturer's instructions to ensure that it consistently operates within established specifications. If equipment has been repaired, moved, or modified, then recalibration and/or revalidation must be conducted in accordance with the establishment's standard operating procedures and/or the manufacturer's manual before further use. Critical supplies must be qualified or validated as applicable prior to being made available for use in conducting an activity. Making supplies available to be used must be based upon established specifications and may include visual examination, lot-specific release, and review of certificates of analysis. Only supplies that meet the documented requirements must be used. The conditions of use and storage for each critical supply must meet the conditions specified by the manufacturer. Any critical supplies not meeting the required specifications must not be used. Under the safety regulations, an error is a deviation from the standard operating procedures or applicable laws that could compromise human health and safety or the safety of sperm and ova. An accident is an unexpected event that is not attributed to a deviation from the standard operating procedures or applicable laws that could compromise human health and safety or the safety of sperm and ova. The regulatory requirements for errors and accidents, including investigations, reporting, and record keeping, apply to all establishments and health professionals regulated under the safety regulations. This not only applies to primary establishments, but establishments and health professionals that conduct regulated activities that fall under the safety regulations. Establishments and health professionals may suspect that an error or accident accident occurred during an activity that they conducted or during an activity conducted by another establishment or health professional, and therefore it is critical that all involved establishments and health professionals communicate and follow the applicable requirements to ensure that all affected parties are aware of the error or accident and any results of the investigation. Notification and communication are essential to the error and accident requirements. Establishments are required to have standard operating procedures in place to ensure there is a process on how to handle, investigate, and report errors and accidents. If an establishment or health professional has reasonable grounds to believe that an error or accident has occurred by another establishment during the processing, distributing, or importing of sperm or ova, they must immediately determine the donor identification code and donation codes, quarantine implicated sperm or ova, notify the establishment they received the implicated sperm or ova from, and in the case of an establishment, notify every establishment, health professional, or recipient to whom it distributed the implicated sperm or ova. For primary establishments, if there are reasonable grounds to believe the error or accident occurred at an establishment conducting activities on their behalf, they must also initiate an investigation into the suspected error or accident. A primary establishment must always conduct an investigation into a suspected error or accident, whether the error or accident occurred during an activity they conducted or at an establishment conducting activities on their behalf. All establishments and health professionals who have reasonable grounds to believe that an error or accident occurred during an activity that they conducted, or establishments that receive a notice that an error or accident may have occurred at their establishment, must immediately determine the donor identification and donation codes of the implicated sperm or ova and whether any other sperm or ova may be implicated in the same error or accident. For example, other donations from the same donor or other donations stored in the same storage container if the EA pertains to storage conditions. The establishment or health professional must identify and quarantine any implicated sperm or ova in their possession and control and initiate an investigation into the error or accident. In the case of an establishment conducting an activity on behalf of a primary establishment, they may request the primary establishment to conduct the investigation on their behalf. The primary establishment must always conducting an investigation into a suspected error or accident, whether the error or accident occurred during an activity they conducted or at an establishment conducting activities on their behalf. For example, if an error was identified at a donor testing lab that is conducting processing activities on behalf of a primary establishment, the testing lab must notify the primary establishment. The testing lab must ensure an investigation is conducted. However, the lab could request the primary establishment to conduct the investigation on their behalf. If the primary establishment accepts, the testing lab does not need to conduct their own investigation but must share all required information with the primary establishment. The primary establishment must conduct an investigation into the error regardless of whether or not they are also conducting the investigation on behalf of the testing lab. The testing lab must cooperate with the primary establishment to provide them with any relevant documentation, documents, or information. Establishments or health professionals that conducting an investigation into a suspected error or accident that could lead to an adverse reaction must submit a report to Health Canada. Not all suspected error or accidents need to be reported to Health Canada. However, establishments and health professionals are still required to investigate and meet the requirements set out in the safety regulations for all suspected error or accidents that could compromise human health and safety or the safety of sperm and ova. If the error or accident was identified after the implicated sperm or ova was released from quarantine and made available for use or distribution, and the error or accident has led to or could lead to an adverse reaction, this would be reportable to Health Canada. However, when an error or accident has been identified before the implicated sperm or ova has been released from quarantine and made available for use, this would not be considered reportable, as that error accident could not lead to an adverse reaction. A preliminary report must be submitted within 72 hours of the start of the investigation, with interim reports being submitted 15 days after the start of the investigation and every 15 days after that until a final report is submitted. The final report must be submitted within 72 hours of the completion of the investigation. A primary establishment must ensure that establishments conducting activities on their behalf that are investigating an error or accident that could lead to an adverse reaction submit the required reports to Health Canada within these timelines. A primary establishment can report on behalf of an establishment that is conducting activities for which they are responsible. For example, a foreign establishment that processes sperm or ova on behalf of the primary establishment. Establishments must have clear standard operating procedures on how error or accidents will be investigated and reported under these regulations. The error and accident reporting form will be available on Health Canada's website when the regulations come into force.
Under the safety regulations, an adverse reaction means the unexpected presence of an infectious disease agent or the unexpected occurrence of an infectious disease in a recipient of sperm or ova or a child from that sperm or ova. The definition of an adverse reaction is important for two key reasons. First, it incorporates two aspects of disease transmission: infectious disease originating from the donor and possibly infectious disease that may be the result of contamination in the supply chain. With respect to the supply chain concern, this could also complicate the investigation of an adverse reaction by the primary establishment, given it would potentially lead or need to determine where in the distribution chain a problem occurred. Consideration was made for this when determining timelines for reporting requirements to the Minister. The second aspect that's important to note is that an AR, or an adverse reaction, can not only occur in a recipient like other regulatory schemes, but also uniquely an adverse reaction could occur in a child born through assisted human reproduction. With respect to genetic disease transmission, it should be noted that it is not in scope as part of the adverse reaction definition. However, in some cases, this may be considered an error or accident under the safety regulations. For example, if a donor was not screened for genetic diseases in accordance with the requirements of the regulations, this would be considered an error, as it could compromise human health and safety and the safety of the sperm or ova. The adverse reaction provisions apply to all establishments or health professionals that are conducting a regulated activity under the safety regulations. As a result, establishments need defined processes and procedures on how to identify, gather information, and address any adverse reactions that occur, all laid out from Section 69 to 76 of the safety regulations. The procedures must ensure that there are instructions, for example, in other words, SOPs, on how to conduct an investigation and implement corrective actions. A very important note: although all establishments must have processes in place to handle an adverse reaction, the primary establishment is the overall responsible party for the adverse reaction investigation once it becomes aware of a suspected adverse reaction, including corrective actions and reports to the Minister. This slide is a basic flow chart of how actions are supposed to proceed. If an establishment or health professional has reasonable grounds to believe an adverse reaction as defined by the regulations has occurred, action must be taken to mitigate possible risks. Establishments and health professionals must immediately determine the donor identification code and donation codes and quarantine any implicated sperm or ova in their possession. Communication is essential when an adverse reaction has occurred. It is important that the primary establishment that processes sperm or ova is notified, as well as the importer if the sperm or ova was imported. The notice must contain as much information as is available at the time, including clear explanations as to how the safety of the implicated sperm or ova has been compromised. Importantly, any establishment receiving such a notice must take appropriate steps, including notifying any establishments to which it distributed the implicated sperm or ova. There are two key aspects here: investigation and reporting to Health Canada. The primary establishment is the responsible party for conducting the adverse reaction investigation and must immediately initiate an investigation upon receipt of the notice. All establishments and health professionals must cooperate with the investigation, providing the primary establishment with any relevant documents or information. The start point of the investigation is also important, as reporting requirements to the Minister are based on this. The preliminary report must be submitted within 72 hours after the start of the investigation. Once an investigation is complete, the primary establishment must communicate the results of the investigation to the parties to which it distributed the implicated sperm or ova, including any corrective actions that need to be taken. Further, any establishment receiving such notifications must forward the results to parties it may have distributed the implicated sperm or ova to. Section 73 of the safety regulations makes it clear one cannot release anything from quarantine without the written go-ahead from the primary establishment indicating safety has not been compromised. Now, with respect to reporting to Health Canada, both EA, or air accidents, and adverse reactions are important reporting tools as they provide the minister with the potential areas of non-compliance that may impact human health and safety. The start of the investigation is important as it is the date that the clock starts for reporting to Health Canada. If the primary establishment receives an adverse reaction and it meets the regulatory definition under the Act, it must report it to Health Canada within 72 hours of starting the investigation. Interim reports are required to be submitted every 15 days, and a final report must be submitted within 72 hours of completing the investigation, including details concerning the results of the investigation, any corrective actions taken, and the final disposition of the implicated sperm or ova. All ER reports are sent to the Health Canada's Canada Vigilance Program administered by the Marketed Health Products Directorate. As part of this program, a new form specifically designed for adverse reactions associated with assisted human reproduction is in development and should be available by the coming into force date. The intent is to have this web posted in time. However, should it not be, the primary establishments can be sent the form directly once ready. If there are any questions or concerns, do not hesitate to contact the Canada Vigilance Program as per the contact information in the guidance document.
Okay, records. Establishments and health professionals all have specific record requirements under the safety regulations. This includes primary establishments that process, establishments that import or distribute, and establishments and health professionals who make use. Records must be kept for 10 years unless otherwise specified in the safety regulations. Among other transitional provisions, the safety regulations provide transitional provisions for primary establishments that were processing or establishments that were importing or distributing sperm or ova before the regulations come into force to continue to do so despite sections 4 or 18, provided the establishment sends the application for a registration or notification to Health Canada within 90 days of the coming into force of the regulation. This registration or notification must be submitted by May 4th, 2020 in order to meet the 90 days. All sperm and ova obtained as of February 4th, 2020 and intended for use in assisted human reproduction must meet the requirements of the new regulations. However, the safety regulations do have transitional provisions for sperm that was obtained prior to the regulations coming into force under Section 90 of the safety regulations, including record-keeping requirements. These requirements take into account the processing and distribution of semen regulations and the Donor Semen Special Access Program, and this section must be reviewed if you fall into this category. Okay, the next couple of slides will provide you with an overview of what to expect during an inspection. The Assisted Human Reproduction Act provides the Minister with the authority to designate inspectors for the purpose of verifying compliance and preventing non-compliance with Sections 8, 10, and 12 of the Act. Health Canada's inspection approach in relation to the safety regulations is risk-based in design. Regulated parties that we consider to be conducting higher risk activities will be subject to more frequent inspections. Health Canada anticipates beginning to conduct inspections in fall of 2020, and these will be conducted in accordance with Health Canada's inspection approach for the safety of sperm and ova regulations, which will be available online. Compliance and enforcement actions are taken in accordance with the Compliance and Enforcement Policy for the Assisted Human Reproduction Act, which is available online. The objective of an inspection is to assess the compliance of regulated parties with the safety regulations and will normally be scheduled in advance with the regulated party. Unannounced inspections may be conducted if, for example, there is an immediate risk to human health and safety, or this approach will better assess compliance with the AHR Act and its regulations. During the inspection, designated inspectors will carefully at the establishment or health professional's compliance with the applicable requirements set out in the safety regulations. Areas covered during an inspection may include quality management system, the adequacy of facilities, record keeping, validation processes, equipment qualification and maintenance, training records of staff, written procedures, donor testing and donor suitability assessments, exceptional access records, error and accident investigation and reporting, adverse reaction investigations and reporting, labeling and storage. During an inspection, an inspector notes deviations or deficiencies from the applicable requirements of the AHR Act and the safety regulations. These deviations or deficiencies appear as observations on the inspection exit notice provided to the regulated party. The exit notice will provide an overall rating to the establishment, either compliant or not compliant. A compliant rating does not, however, mean that there are no observations. A response to the observations in the exit notice is required. The regulated party must provide in writing corrective actions to address each part of each observation. The inspector will assess the response and effectiveness of the proposed corrective measures and may request additional clarification or information.
So now we will move on to the question and answers part of the presentation. As mentioned at the beginning of this presentation, the following slides are intended to provide responses to the questions that were submitted in advance of this webinar and weren't addressed throughout the presentation. So we received questions about the segregated storage requirements. So segregated storage applies to sperm or ova that is either required to be quarantined or that is released under directed donation or exceptional access processes. In other words, donor sperm and ova that is required to be quarantined or that is released from quarantine under the directed donation process or exceptional access process must be kept segregated from sperm and ova not intended for such purposes. Segregation can take the form of storage in a physically separate area, or it can be done through a validated electronic segregation. For example, donor sperm or ova that are required to be segregated, as mentioned above, may be in the same cryotank as other sperm or ova with the use of appropriate cryogenic supplies or with the use of electronic segregation system that is validated for such use to prevent improper release. We also received questions about the requirements for assigning donor identification codes and donation codes. So a donor identification code is the unique group of numbers, letters, symbols, or a combination of any of them that is assigned to a donor. Whereas a donation code is the unique group of numbers, letters, symbols, or a combination of any of them that identifies the sperm or ova donation. Also, the donation code must link the donor to the date of donation. There are no prescriptive requirements to design donor identification code or a donation code, and as such, any unique code assigned to the donation or the donor will be sufficient, provided it meets the above requirements.
Okay, we also received questions on training. What training is required for personnel? Establishments must have the following training for personnel as appropriate to their job responsibilities relating to activities regulated under the safety regulations. Initial and ongoing training for regulated activities, including remedial and retraining as appropriate for their duties. Training for all regulated activities carried out with respect to sperm and ova, and the training must be provided by qualified personnel who have knowledge with regard to the functions involved. Training may involve hands-on conduct of activities and/or reading of SOP prior to completion of tasks, depending on the complexity of the process. Okay, question regarding what are the requirements for the environmental control system? Establishments must have a system for controlling and monitoring appropriate environmental conditions and must monitor the system to ensure the established environmental parameters are maintained. Establishments must have environmental monitoring procedures, which should include acceptable limits for all environmental parameters that are relevant to the activities conducted at the site. When the values are found to be outside of the acceptable limits, corrective actions must be taken and may require relocation of the sperm or ova or temporarily discontinuing the specific activity. Another question was, what are written specifications in the context of critical equipment? Establishments must have a program to identify, document, and track all critical equipment, supplies, and services. It is up to the establishment to ensure that the specifications are documented, for example, in an SOP listing the requirements that the equipment must meet, in such a way that this information is available to all required staff. Critical equipment must consistently meet its specifications in order to ensure the safety of sperm and ova. Okay, so this concludes the overview of the new Safety of Sperm and Ova regulations. I want to thank everyone for taking the time to join this presentation and remind you, if you have any questions, please contact the Biological Product Compliance Program at the email address provided. Also, please refer to the guidance document for additional contact information in relation to submitting applications for registrations and notifications, as well as adverse reaction reporting. Thank you.